Hey, Dr. James Fenich here, Village Family Clinic with a short video for you. I just had two patients come in with spinal stenosis. So it's something we see in the clinic here an awful lot. So I just want to shoot this quick video, explain you what spinal stenosis is and how we might be able to help you. So real simple, we all know the brain's up top, spinal cord comes down the middle and goes to every cell, tissue, organ in the body. Now the spinal cord runs through this little canal here, the central canal, and the nerves branch off the side here and come through these little foramen or hole there. So when we're nice and young and everything's nice and open, we have a nice big space in there for that nerve. Now, as we get older, it doesn't matter how healthy we are, these spaces get a little more narrow over time. And eventually you can start pinching, choking, or rubbing off the nerve. Real bad spinal stenosis can even cause people to be in wheelchairs, paralysis. That nerve is being totally choked off in there. Now, it's a normal part of aging. It can accelerate faster. We get car accidents, wrecks, falls. Sitting too much at work can speed this all up and make this happen a lot faster. In fact, people in their 20s can get spinal stenosis, even though it's more common a little bit older. I just had a patient yesterday from jiu-jitsu, started really young with stenosis. So that channel gets smaller and smaller. Now you can get a needle injection in there. They're going to stick a big needle in there, put some cortisone on there, numb the nerve for a little bit, but ultimately it's going to come back as it's still being pinched in there. You can also take some pain pills. You might not feel it as much, but it's still getting choked off in there. The other option, if you go to surgeon, they're going to do major spinal surgery on you. They're going to remove the back part of your vertebrae, take these, throw them in the garbage can, put 4 screws in there and 2 rods in there to hold that vertebrae apart a little bit. Now, obviously, it's a major back surgery, costs 50, 60, 70, 80, even $100,000. You got to work for 6 months to a year if it even works. What we do here for spinal stenosis is something a little different. We're one of the few offices of non-surgical spinal decompression. It's advanced form of traction. So if we come in like this machine that I'm sitting on right here is able to gently open up that nerve channel by pulling harder and harder with a computer-controlled traction. It's able to pull at a certain pattern, a certain rate. It's also able to send some feedback. So if it's feeling your muscles pull back, it'll release and pull a little harder, real controlled panel. It's highly effective for spinal stenosis. It's the only really non-surgical option that's going to be effective for you. We're able to do it here. We have 2 offices here, 2 tables in the office here. We've done thousands of patients with spinal decompression. So if you already know suffering from spinal decompression, don't give us a call or a text at 908-813-8200.